Medical professionals. What was a time where a patient ignored you and almost died because of it? My dad worked for a company that was based in northern USA. The owner was Canadian and had a cabin up in Canada. He was visiting the cabin a few summers back. He had some medical issues happen and went to the hospital. They said something was wrong with his heart and he needed surgery. He called my dad because he knew my sister was a doctor and wanted a second opinion. They scheduled the surgery in Canada for a few months out. My dad called my sister and my sister said in the USA they would never let anyone leave the hospital with his condition and he would be in surgery that night. She said he needs surgery now. Well, he left the hospital and a few days later, he was dead. It was a sad I told you so. Okay, the patient in this story is a horse, and in order to fully understand this story, there are a few things about the horse that you have to know. Horses have something in their bodies called a guttural pouch. This warms oxygen that is on its way to the brain. There is a blood vessel that is under the guttural pouch, and sometimes horses can get a fungus in the guttural pouch that slowly erodes the blood vessel, causing nosebleeds. The vessel will rupture, heal, and the cycle goes on until one day it ruptures and the horse bleeds out. This condition is called guttural pouch mycosis. It is diagnosed via endoscopy and is deadly if left untreated. Now, I'm in no way a medical professional, but heard this story from an equine vet. She was called out to a farm because a horse was experiencing repeated nosebleeds. She was pretty positive that the horse had guttural pouch mycosis, and she and the owner decided that the vet would scope the horse. She went to get the scope, and when she got back, the owner had changed their mind. She didn't want the horse scope. The vet left. She was never told definitively that the horse died, but the next time she went to the farm, that horse was nowhere to be seen. Aw man, horses are like my second favorite animal that I regularly see. Equine creatures are just cool, but then again, I just got back from the safari park and I'm kind of vibing with sea lions right now. Sea lions are dope. I'm a vet tech, so my problems are my clients, not my patients. Patients just do what they're gonna do. But boy, do we have a problem with client compliance. You'd be amazed how many times we get something to this effect. Dog comes in very sick. Through testing, we find out the dog has Addison's, heart failure, thyroid disease, something else that is a lifelong disease that can only be treated with lifelong medication, not cured. We explain all of this, and possibly after an expensive hospital stay, we send owner home with a month's worth of medication. Several months go by, and O calls upset that their dog is sick again. Yeah, you haven't picked up any heart medication in 5 months. Have you gotten it at another clinic? No. Yeah, no, come in, and thanks for messing up everything. Or 2 years ago, you came in for your regular exam. We talked to you about preventing heartworm disease. You said our prevention is poison and you'd use a safer, more holistic method, and now your dog is here coughing and weak. Hello, heartworms. No, your essence of lavender, your rosemary, your coconut oil, your apple cider vinegar, and every other bit of bullcrap you can throw at me doesn't kill heartworms. Your dog isn't a raw chicken. Stop marinating him, for God's sake. Also, gotta love the very classic, I gave him his antibiotics, pain meds and steroids for 2 days and he got better, so I stopped. Now he's worse again, and I cannot stress enough the importance of restricting activity after your pet has surgery. Yes, she feels good, enough to run around the yard maybe. That's because she's on pain medication. That does not change the fact that we just removed multiple organs out of her belly hours ago. And now you're bringing her in with her intestines swinging in the breeze and blood everywhere. Thanks for nothing, dumb butt. Just do what we tell you. I swear to God, so many lives and a bunch of heartache and money could be saved if people just did what we tell them to do. You're paying us money for our opinion. You're taking the time out of your day to come sit down and talk with us, all just to go, well, yeah, but I read this on Google, or, well, my dog is too smart to do something like that. I know my dog better than you. It's baffling. Yes, you do know your dog better than me, but I know dogs in general better than you, and I can say you'd be hard-pressed to find a dog that won't do some stupid crap in their life because they're a dog. Your dog is not so smart that he won't screw his sister, eat a bunch of grapes, or rip apart his bandages. It is your job to watch over them and ensure they don't do those things. So just do what we frickin' tell you to do, Christ's sake. It sounds like this person needed to vent, but also this all sounds like I'm guessing they're not being specific specific. It sounds like they're talking about a single individual. Medical student here. Last summer I was doing ER practice and a guy came in with a massively swollen leg, which was deep vein thrombosis, a clot in your leg vein that can dislodge and travel straight to your lungs and kill you. That same guy came in some months prior with the same condition and was explicitly told that if his leg hurts again and starts to swell, to sit down and not walk. Apparently this time the guy came, he walked to the ER, like 20 minutes of walking. He didn't die though. I guarantee if it's an older gentleman, they probably just completely disregarded that information that you told them and went, I'll walk it off. And when that didn't work, then they said, okay, maybe I should go to the hospital. Diabetic patient who broke his ankle left the cast on for 6 months because he didn't want to bother coming back to the hospital. Our front bubble stunk of rotting flesh. It's a fairly large room and the cast was still on. We move him to another area. I'm hovering over ortho as he is taking the lower part of the cast off. On the outside, on the medical aspect of his ankle, you could see there was some fluid from the inside that stained the cast, this nasty color. When the cast popped off, it looked like zombie flesh, oozy, gangrenous, stunk like death. The funniest part about it is when the ortho resident is talking to him about what the plan is going to be, a fly kept buzzing around and landing on his exposed, nasty leg. I am not a medical professional, but one time my grandpa had a surgery and was told not to smoke for a while, and when he got home, he smoked and burst an artery and bled all over the back seat of my dad's car. That sounds terrifying. Imagine taking a puff of a cigarette and then just gush, blood everywhere. Had a very drunk, less than cooperative older gentleman come into the trauma ICU after getting into a fight with his lady friend, who then stabbed him in the neck with a screwdriver. She luckily missed his airway, but nicked a large vessel. He had a hematoma forming on the side of his throat that was growing quickly and endangering his breathing. Wheezing and stridor could be heard with every breath, and he was doing a good bit of bleeding. He needed surgery to repair the vessel and decompress the hematoma. Dude was so wasted and uncooperative that he blatantly refused and kept trying to leave. The doctors were scrambling to get paperwork in order to do the procedure with an emergency consent, as the patient was obviously impaired. Patient frantically motions for me to come to his bedside. He's coughing and sputtering. I look him straight in the eyes after assessing to make sure he was still maintaining good oxygen saturation and say, "You can't breathe." He nods frantically. "Well, that's a shame because you sent away the surgeon that was going to fix that. You want me to go get him?" More frantic nods. "You going to let him do the surgery and fix your throat this time?" Continued frantic nods. I call over my shoulder to the now group of OR personnel discussing the logistics of keeping the operation legal. He consents. They jump and literally run with his butt to surgery. Fixed him up. He spent a couple days on a breathing machine just to prevent his throat from swelling closed post-op. If we would have let him walk out, he would have suffocated in the car park. I have not been in the medical field for long, 6 months at most, but have seen many people who come in for rehab after having a heart attack who ignore their fluid restriction. I've seen this turn into a fatal situation 3 times already. Drinking water to death, who would have thunk it? And that is where the saying everything in moderation comes from. Because yes, you can in fact drown yourself to death internally by drinking too much water, apparently. And no, don't worry, it would have to be just an insane amount of water, like, I don't know, 50 liters or something. Every opiate addict that refuses to go to the hospital after you give them naloxone to reverse their overdose. They regain consciousness and refuse transport, and we explain that the naloxone will wear off and they will be right where they started. They still refuse care. We get back in the rig, drive around the block, and wait for 911 to be called again. My own experience with doctors is that, because I hate every medical procedure, I just tell them that no painkillers, nothing. Dentists always start drilling and pulling right away. My tongue needed surgery, so they just cut it, and I took no painkillers. They told me that I might be the easiest patient ever. No need for painkillers, just do what you gotta do and we can get out fast. Actually, I have a minor, nowhere near death one myself. Needed to have an abdominal ultrasound, told not to use the bathroom for however long beforehand, but it was mid-morning and I woke up needing to go. I told myself I'd drink a bunch and I'd fill up again fast. Nope, had to sit in the waiting room for hours until I was full enough to be good. Not a doctor, but here's what happened to me. My mother is an anti-vaxxer and generally against medical intervention. I didn't get my vitamin K shot as a baby, and I've never been vaccinated for anything. At around 5, I was being being an idiot kid and playing around with old bamboo sticks. I liked to dip them into this nasty bucket of water we had that had been rotting in the backyard forever and fling it around to see the droplets in the air. We later found out that a neighbor kid had used it as a toilet at least once. I came down with something horrible that probably almost killed me. Very, very high fever, lethargy, nausea, and little red spots covering my entire body. I don't remember much from that time, but I remember how awful it was. My parents assumed that it was chickenpox and decided not to take me to a doctor because it would strengthen my immune system. I was actually fine eventually, but it did definitely feel like I was going to die at the time. Fast forward to age 13, I actually got the chickenpox and luckily fairly mild, but this left the question of the mystery illness's identity. I've done some Googling and my best guess is typhoid, but I have no clue really. I'll be 18 soon, and I'll be getting vaccinated as soon as I can. I don't understand even at an early age what your fixation might have been with that apparent poop bucket. My dad is a veterinarian. My clinic calls them patients, their owner, clients. We had a dog come in with strychnine poisoning. You start convulsing and any stimulus, no matter how small, makes it worse. The very same convulsions cause a chain reaction and eventually spreads to every muscle in your body. You die from exhaustion, or when the neural pathways that control breathing stop working, and it is a painful way to die. We saved this dog, miraculously. We tell the owner to put the poison somewhere where the dog can't get it. Dog comes back in later, same symptoms, same poisoning. We save it, somehow, again. Owner promises and swears it will be gone this time. Nope, third time is the charm. Dog is saved, yet again. At this point, the dog really isn't a dog anymore. Might as well be a potato at this point. It can barely move. Owner says that they can't lose the dog or bear to see it in pain. The poison will be disposed of. Yeah, no, the fourth iteration of the poisoning killed it. You saved it the first 3 times. Why was this time different? I feel really bad for that dog. A patient who had a spinal decompression and fusion procedure was recommended to continue using a walker when ambulating and also to arrange for personal assistance at home. Decided she was too good for help and a walker is for the disabled. Fell out of bed, a nail from the hardware punctured into the spinal nerve. She was readmitted to the hospital and is now paraplegic. From the initial need for a walker, the patient now needs to be assessed for a wheelchair. The patient didn't die, but nevertheless, a severe consequence. I don't know why this kind of reminds me of how I was taking the pictures off the wall on a narrow stairway when we were moving furniture, and they were like, why are you taking the pictures off the walls? And I was like, because I'm being careful. I don't want us to hit them and for them to fall down. And they were like, no, don't worry, we'll be careful. It's like, no, you don't understand. Me being careful is taking the pictures off the wall. Man, though, that is some unfortunate luck, and I feel really awful for that patient. Like, that is just a result of hubris. Patient with one leg, instructed not to get up without assistance. Bed alarm in place. Bed alarm sounded. We run in there just in time to see him up. He says, I wanted to see if I could walk without my prosthesis. So basically, he tried to walk with one leg. Didn't work. Not me, but my dad is a cardiac nurse. This is probably my favorite story from him, and yes, I feel awful saying that. Anyways, you know how smoking is bad for your lungs? It's also really bad for your heart. It causes buildup in your arteries that can cause heart attacks or strokes. My dad performs surgeries on way too many smokers and sees some of them repeatedly. My dad, the other nurses, and every doctor will tell them they will be back if they don't quit smoking. But, of course, they don't. Now, for the part that is actually why it's my favorite. My dad is obese and has never denied it. One time, while having the stop smoking talk with a patient, he got super offended and told my dad that being obese was bad for his heart and blah blah. My dad's response? I can lose weight. You can't lose stupid. Guy got stabbed in the arm with a knife, refused a tetanus shot, came back with full-blown tetanus, arching his back, clenching his jaw, straight to the ICU. Had a patient who had just gotten a below-knee amputation. We gave him the prosthesis shortly after surgery, as soon as surgeons signed off, and told him several times to take it easy. He was very excited, and we knew he was not going to listen. To stress the issue, we had the owner of the company and several co-workers who are also amputees talk to the patient. Being a new amputee, the limb goes through a lot of changes and is still healing. After he took his new leg home, we hadn't heard from him in a few weeks. He even cancelled his follow-up appointment since he was doing great. A week after that, one of our co-workers calls us and tells us that he was at the surgeon's office, just stopping by to say hi and bring them breakfast, and saw said patient waiting to be seen since his limb was scabbed over, with several lesions and extremely discolored. After asking what happened, he told her that he was feeling so good with the prosthesis, he decided to run a marathon and Tough Mudder. He ended up getting a major infection due to the mud and is extremely lucky that he did not need a revision, making him an above-knee amputee. For anyone who doesn't know what Tough Mudder is, I don't know if it's a UK thing exclusively, but it's basically a mud run. That's it, really. It's just lots and lots of mud. The patient was me and the medical professional was my aunt in this situation. Isn't blood related to me, but she's basically family. I can't remember the actual medical term for it, but I call it deadly asthma. This happened last year, which makes it the second time I've had it. First time I had to go to the ER at Boston Children's because no one could figure out what was wrong with me and I was getting increasingly worse. Basically, the symptoms are close to the symptoms of walking pneumonia. This time that I got it, I was told to take my neb treatment 3 times a day and take some heavy meds. Now, I have had asthma my entire life. I tend to not take my rescue inhaler if I feel like I can get through an attack. I get 2 to 5 attacks a day, so yeah, I'm pretty severe. I take Symbicort, but had basically lost my inhaler and never really looked for it, so I stopped taking it. It pretty much allows me to not even have a single attack every day, which is awesome. Being a teenager, I am kinda irresponsible with my own well-being, so I stupidly didn't do what I was told. I ended up not taking the nebs because they make me sick, make my tremors worse, and make me unable to walk normally for a couple of hours. Well, let's just say at night I was suffocating and close to just not breathing at all, but still said I'm fine, which more or less was because I was delirious. I was driven to my pediatrician's office and they put me on the neb. They said I could have crashed, medical term, not car crash, and died if my mom waited to drive me there. My oxygen levels were low, and I was about to pass out because I couldn't breathe. My aunt gave me a good scolding, told me she'd send me to the ER if I didn't take my neb treatment, so I followed her orders that time. Took me another 2 to 3 weeks to fully recover and had to be put on even more meds. I think sometimes I underestimate the dangers of my condition because I go through it so much. Let this all be a lesson to, not do that again. In this story, it wasn't the patient that ignored the warning, but the hospital staff. This isn't my story, but a story from my professor that ultimately led to him stop practicing and start teaching. My professor has a heart of gold, just the most genuine man you could ever meet. He works in an adolescent psych ward. Well, one kid comes through and they really bond. He spoke about him with such a big smile. You can tell he really cared for him. He loved this kid, but he notices something is off. He speaks with the staff on the unit and asks them to make sure he is on self-deletion watch. His gut is telling him the kid is planning something. Well, he was right. The staff didn't check in at all until the next morning. The kid had managed to delete himself. It just completely broke my poor professor, shattered him personally and professionally. It's such a terrible story to hear because it was so preventable, but no one else decided to care. As for me, well, I've had patients completely ruin surgeries from just not listening. One guy got a spinal fusion surgery. Very painful. One thing you can't do is twist your back, so I'm still really new, bright-eyed and hopeful, and I go see this patient. I introduce myself and ask him how he is. He tells me that he's in 10 out of 10 pain sometimes and he can't figure out why. I try to be helpful, ask him what he's doing when he's in pain. Well, instead of just telling me, he frickin' shows me, grabs the bed rails and twists like he was trying to snap his spine. He's screaming and I'm horrified and kind of yelling at him to stop. We get the situation under control. I go back and explain all of his precautions again. He tells me to go screw myself. If he's in pain, I'm not doing my job. Well, he was discharged AMA and he ended up ruining his surgery. Hope he enjoys his excruciating back pain. That's really sad about the kid, but weirdly enough, I actually met someone the other day who said they had a fused spine. Be me, ER doctor. Sir, there is a large tumor in your spine pushing on your cord. That's why you can barely move. I've already spoken to our spine surgeon. You're going to go directly to the OR. Patient says, I'm a tough son of a gun and I don't need no surgery. 30 minutes of me screaming at him later. For the love of God, I promise I know what I'm talking about. If you don't get surgery, you will be a quad. The patient simply retorts, screw you, I'm going home. Patient became a quad. Wife sent me a very long apology letter. Be me again, sir. One of your cardiac enzymes has come back elevated. I think you are having a heart attack. I've already spoken with the cardiologist and we are going to get you over to the cath lab now. The patient's response?
Bro, I'm in town for Comic-Con and I am not missing it. I'll come back if it gets worse.
30 minutes of me screaming at him. For the love of God, I know what I'm talking about. Pretty please with frickin' sugar on top. Stay! The patient uncaringly replies,
Gotta get to the con. My favorite artist is on at 4.
Dude came back in cardiac arrest. Much of my job is to mess up Darwinian evolution. Weirdly enough, I have also thought about that in terms of doctors and how, like, you know, people with genuine hereditary issues are, like, the most in need of them. And that has got me thinking about the friend that told me that every single male in his family line has, like, had a heart attack around their 30s. When you subscribe, make sure to hit the bell to turn on notifications. Put the playlist on in the background to finish listening to all the stories. And if you like Am I the Genius, give Am I the Jerk a shot. Linked in the description below.